compliment of the season to everyone listening to us, listening to me at this moment. Welcome again to another edition of Fitness on Pensioners 106.7 FM. Agbari Goni again, the city of Ibadan. This is a program that takes a look at various forms of diseases and, of course, give you professional advice on how you can live a near perfect and healthy life. 4 p.m. to 5 p.m. every Monday. This is where it goes down. And of course, welcome to another edition. Lovely edition, definitely. You will still enjoy. And of course, add more knowledge to your healthy tips. My name remains Raymond Tolulope. And of course, we've got the usual team in the house. We've got the usual team in the house as we do every Monday. I've got Ambassador in the room, okay, right here in the building. Good afternoon, man.
Good evening, Raymond. Compliment of the season.
Same to you, man. And I've got Dr. Akinwumi also in the building with us. Good evening, sir.
Thank you very much, Raymond. Good evening to our listeners. A wonderful Merry Christmas in arrears to us all.
Okay, you've heard your voices, and of course, like we used to do every Monday before we go into the topic of the day, what should be done and what should not be done before you go in for any exercise. Ambassador Romokayinde Keromli will take us through that in a jiffy.
Good evening, listeners at home, and compliment of the season. Like we used to discuss on this program, we need to know do's and don'ts before we can embark on any exercise, because we don't know our health status and we need to establish the fact that we are okay before we can start any program. First of all, we need to check our BP. We make sure that is in the right order. The same thing with the blood sugar test. This will enable us to establish if you are diabetic so that you won't go more than your capacity. Another one is the ECG, which is very, very paramount to us, because before you can do any program, you need to know how strong you are. So by the time you do the ECG, they will be able to tell us that the result will be able to say exact program that you can do or your limitation to any program. Because without that, we don't know what is happening in your heart at that particular time. The only way by which we can know if your heart is okay is by doing the ECG test. After all aforementioned, the next thing is to be in a good attire. Put on good attire for the exercise, not that you wear agbada and you say, okay, I'm just walking around within the house, so let me just put this on, or let me put on a towel and use my treadmill in my bedroom. No, because this may cause another accident. Like I said, if you want to start any exercise, any program at all, you have to warm up. Warming up is very essential because by the time you warm up, this will prevent you from having cramp, all those things, to prevent the accident. Even if there is going to be accident, it's going to be minimal. So it is always good to start with warming up, and when you want to end it, you cool down as well. Not that you just start from the high intensive activities whenever you want to do exercise. So it's very, very important, so that once we have all what we have said, you are good to go. So you now do it at your pace, not that at the pace of someone that wants to go and represent Nigeria at the Olympic. Other will say, this one is doing it, I can do it as well. No, check yourself. Make sure you don't overdo the things so that there won't be problem again.
I'm younger now, so why should they be doing more runs than I'm doing?
So it's not like that. So gẹ́gẹ́ tí mo sọ tẹ́lẹ̀ tí mo ń gbìyànjú láti sọ ni pé tá bá fẹ́ ṣeré ìdárayá, ẹ jẹ́ ká rí i pé gbogbo àlàáfíà wa ó péye. Fún àpẹẹrẹ, ìfúnpá wa ká rí i pé kò ga. Tó bá yẹ pé ó ga, wọ́n á sọ pé báyìí ni tá a lè ṣe, gbèdéke nǹkan tá a lè ṣe nìyí, wọ́n á sọ fún wa. Tí àyẹ̀wò ṣúgà tó wà nínú ẹ̀jẹ̀ tá a bá yẹ̀wò tó bá jẹ́ pé ó lọlẹ̀ jù àbò pọ̀ jù èsì jáde yóò máa fi yé wa pé kíní pọ̀ jù àbí báyìí ló ṣe rí o wọ́n á fi bóyá ẹni yìí ó wà diabetes àbí kò wà diabetes kó tó di pé ó bẹ̀rẹ̀ àwọn eré ìdárayá. Èyí tó tún ṣe pàtàkì jù ní ECG tá a máa ń ṣe láti mọ ipò tí ọkàn wa wà tí a mọ̀ pé ọkàn wa yìí o ó ń ṣiṣẹ́ dáadáa bó ṣe yẹ kó ṣe àbí báyìí ni o ìgbà mìíràn tó máa ṣe àyẹ̀wò yìí òun ló máa fi yé wa pé ẹni yìí o kò lè ṣe ju aerobics lọ o ẹni yìí o kó má débi báyìí ẹni báyìí kó bọ́ lọ lórí ìjẹ́jú ṣẹ́jú 5 lọ ṣùgbọ́n tá a bá ṣe àwọn àyẹ̀wò tá à ń sọ a ò ní mọ bí ẹni ṣe lágbára tó àti pé tá a bá fẹ́ ṣe eré ìdárayá a gbọ́dọ̀ wọ aṣọ tí ó bá eré ìdárayá mu kì í ṣe pé ká wọ agbádá àbí ká rorò máyà ká ní treadmill wà nù yàrá wa ẹ ṣáàjà mọ́ ogun Ìbàdàn lọ sẹ́kọ̀ọ́ kò rí bẹ́ẹ̀ rárá torí pé kí ni ọlọ́mọjà ṣe eré ìdárayá kan lápá àgbọ́dọ̀ wọ Dunlop kálá fẹ́ máa lo treadmill gbogbo orú àwọn kan báyẹn la gbọ́dọ̀ rí dájú pé a fìdí ẹ̀ múlẹ̀ kó tó di pé a bẹ̀rẹ̀ sí ní ṣe eré ìdárayá ju gbogbo ẹ̀ lọ a má ṣe ju ẹ̀mí ara wa lọ torí pé kì í ṣe pé a fẹ́ lọ gba owó níbì kan àbí a fẹ́ lọ díje ní ìlú ibì kan fún Nàìjíríà so ìwọ̀n tá a bá lè ṣe tí ẹ̀mí wa bá gbé ní ká ẹ jẹ́ ká máa ṣe níwọ̀n gbà tá a bá ti fẹ́ ṣe eré ìdárayá.
You've had a tough one, Ambassador Raymond Lee, on what you should do and what not to do before you jump into any exercise. You can watch us live on Facebook, Pensioners FM live on Facebook. And of course, you can download our app on Google Play Store, Pensioners FM as well, Pensioners FM. You can listen via our website, www.pensionersfm1067.com, and you will be live. We'll go into today's topic, which is a combination of many things. They have one thing in common anyway. I will not, I'm not
letting the cat out of the bag.
Exactly. But when I saw that those topics, I know this is a triple banger.
Sure.
Well, we are at the time that we need this, especially, and because of what is going on presently, so that we can be able to get well already. I've already got people saying, Amata has come. I'm feeling this, I'm feeling that. Okay. We are now ready on fitness. Tune in. Let's go. Okay. Today we'll be looking at influenza, pneumonia, and also what is Begedek at the moment? COVID-19.
How necessary?
Oh, Karilaya.
Oh, serious. Yeah, and you know, when you start seeing people around you this time, they are coughing, right? Sneezing. You now start be like, hey, Ambassador, kill a leave, right? You be like, Emma been sharing mask lewo only come lo mask anyway.
Àsìkò ilé máa mọ̀ pé a fẹ́ràn ara wa lórí èdè.
Honestly,
kì í ṣe pé torí nǹkan mi bí kò ṣe pé kẹ́ni má kó ràn.
Má kó ràn mí ni o.
Ẹjọ́ ṣe fi nǹkan
kan fi bo
madam ṣe ni tissue ani tissue ben ẹ get tissue ben no lo mask yín náà pẹ̀lú. This it's necessary at this time of the year. It's very, very necessary, and that's why today we think we should. Ká tún wo àwọn àìsàn àwọn àrùn tó fẹ́ jọ mọ́ tó wà lóde lónìí bí COVID. We all know, I mean, gbogbo náà láti mọ̀ nísìnyí pé COVID wà nígboro. Adẹ̀ ti mọ̀ nísìnyí pé second wave náà tún ti wà. Bẹ́ẹ̀ ni gbà tó bẹ̀rẹ̀ ní gbà tá bẹ̀rẹ̀ sí gbọ́n pa ẹ̀ around March, February lọ́dún yìí. Ó kọ́kọ́ dàbí kàyéfì fún wa wípé ṣe irú àìsàn wo lélẹ̀ tó tún fẹ́ dàbí pé ó le ju tó ṣẹlẹ̀ ní ọdún tó kọjá lọ bí Ebola pé lélẹ̀ ìwọ wá tún lélẹ̀ tó tún fa kí a máa lọ bí iṣẹ́ tó tún ní kí gbogbo a máa jókòó sílé ká máa lo mask ká máa fúnra wa ní ìgbọ̀nsẹ̀ ọwọ́ ká tó dúró gbéra. But what we've now realized is that COVID is here. Right, and we all have now been taught what to do to prevent COVID. And also part of this is that we've also been told the symptoms, the common presentations, the common signs that patients will notice if they have COVID symptoms at all. And let's not forget, COVID answer, èèyàn lè ní kó má fi àpẹẹrẹ kankan hàn lára ẹni náà. Kéèyàn má tiẹ̀ ní àmì kankan pé òun ní COVID tó yẹ pé ìgbà tán bá ṣe test fẹ́ nìyẹn ló máa tó mọ̀ pé òun ní COVID. Ìyẹn náà wà ń bẹ̀. So ká má kọ̀ gọ́ra wa wípé kankan ṣe mí náà. kódà kan mo ń ta bíọ́bíọ́ mo lè ta pọ́npọ́n yẹn mi ò ní. Please don't ẹ má jẹ́ ká tanra wa. I mean ká má lo òye aláìlọ́gbọ́n ká má fi ṣeré nípa COVID.
Àwọn àṣàyàn àwọn àpẹẹrẹ tí èèyàn máa rí nípa wẹ́dà tá a wà inú ọyẹ́ ó fẹ́ fara pẹ́ àwọn kankan pẹ̀lú COVID ká má wàá fi pé òjò fi pé àìná ó bẹ́tà tí nǹkan bá ti ń ṣe wá ká lọ sí ilé ìwòsàn ká dẹ̀ méṣọ̀pá di ara wa bí ìgbà tẹ́ pé imú tán ní àdè ẹja di imú fún àǹfààní ara wa ni torí ẹni tó bá ní tí ìwọ bá ti fi nǹkan bomú ò ní lè kó àìsàn náà tí o gbọ́ bá lè ṣe bẹ́ẹ̀ ṣe mọ̀ wípé yóò dínkù jọjọ pàápàá jùlọ àsìkò tá a wà yìí ó ṣe pàtàkì ká má sọ pé àkànsí náà ni àkàn wúkọ́ náà bí a ṣe máa ń wúkọ́ nígbà tí ọyẹ́ bá wà ní COVID ẹ má jẹ́ ká fi ọwọ́ yẹpẹrẹ mú Ọlọ́run ní jálùgbàdì rẹ̀.
COVID ò tiẹ̀ wọnú studio. Ẹ má jẹ́ ẹ má gbọ́ oríṣiríṣi ọ̀rọ̀ kì í mú olówó kì í mú tálíkà kì í mú ará ọjà kì í mú ọmọ COVID ó ti wà lóde. And it's now impressed upon every one of us to make sure we take precautions to prevent. It's by preventing COVID that you can stop yourself from having COVID. It's not by just COVID.
Heaven helps those who help themselves.
Ben, heaven helps those who help, and that's why it's very, very important to prevent COVID. And why we're talking about COVID again today is we're not just talking about COVID, but we are also looking at COVID as well as some other respiratory diseases that are commonly experienced in times like this. We're looking at respiratory diseases that have similar presentations like COVID.
Yes.
And simply, you have pneumonia. We're looking at two major ones. We're looking at pneumonia and we're looking at influenza. Those are two major respiratory ailments that we're talking about today, and also comparing them with this giant or this elephant in the room, COVID-19.
Okay, influenza, pneumonia, and of course, in comparison with COVID-19, which is what the world is talking about, the second wave. We'll start from influenza. What is influenza?
Thank you very much.
Influenza.
Ben, that's true. But looking at influenza as a disease in itself, let me also talk about it along with pneumonia. The two of them, influenza and pneumonia, are both infections that affect the respiratory tract, that affect the respiratory system of every human being. They are infections that affects our lungs, right? That affects how we breathe, that affects how we exchange oxygen. Now, ẹ jẹ́ ká bẹ̀rẹ̀ láti bí tá bá sọ pé báwo la ṣe ń mí, a gbọ́dọ̀ kọ́kọ́ bẹ̀rẹ̀ láti bí ẹ̀yà ara wa ṣe rí. We must do some little anatomy. We must examine. We must okay. Let's look at how the body takes care of respiration. Now, when God created you and I, He gave us this nose, right? From where we take in oxygen, from where we take in air.
Yes.
Now, atẹ́gùn tó bá ti gba imú wa wọlé, a lọ sínú ọ̀fun wa. Látó bá gba ọ̀fun wa kọjá, a wá lọ sí ibi tó yẹ kó, a wá lọ sí lungs wa. Mi mọ̀ báyìí pé lungs ní Yorùbá.
Ẹ̀dọ̀, maybe fuku.
Okay. Ambassador says fuku. So I'm gba atẹ́gùn sínú láti imú wa, a lọ sí ibi tó yẹ kó lọ. Láti inú lungs yìí, a máa wá dá oxygen, a máa gba oxygen tó wà nínú atẹ́gùn tá mi wọlé, a máa gba oxygen, a máa gbé lọ sí gbogbo ẹ̀yà ara tó nílò ẹ̀. Now, that is what the lungs is supposed to do. Now, when we now have these small organisms, called bacteria, called viruses, called fungi, when these small organisms have now passed into the same respiratory tract that we've talked about, through the nose to the throat and then to the lungs, they can cause these dangerous ailments that we know as pneumonia or influenza. So for influenza and pneumonia, they are both respiratory infections that affects that affects males, females, that affects children, that affects adults, but they can be caused by different types of organisms. They can be caused by bacteria, they can be caused by viruses, they can be caused by fungi, they have this and this and the type of organisms that causes them also determines how severe or how bad the infection or the pneumonia or the influenza will be. So that's just basically what these two are. And of course, just like COVID also, we know COVID is also caused by a virus.
Yeah.
Abi, that is also, that can be taken in via the respiratory tract and would cause an infection of our respiratory system and our lungs as well. So for be it COVID, be it influenza, be it pneumonia, they are all respiratory diseases or infections to the respiratory tract of a normal human being.
Influenza, pneumonia, COVID-19. They are all respiratory diseases. Okay, moving further, be able to differentiate a little bit of definition on both pneumonia, of course, influenza. But looking at it this way, you said it goes with is a respiratory disease.
Yeah. Yes.
Now, how possible is it to contact influenza or pneumonia?
Very, very easy. Very, very. You remember, I said that this is something that is born that we take in from the air that we breathe in.
Yeah.
So someone that's infected now, someone that's already having the infection already, when this person sneezes or when this person coughs, you understand, or even if it's even by blood or blood transmission, it's possible too. But majorly, when a person sneezes, a person that's infected, he or she now sneezes or coughs, and he or she didn't take the normal precautions, you can have these organisms, these viruses or these bacteria go in through air droplets, okay, and then the person that is normal can then contract them from there, or even just taking in the same infected air. Okay. that was breathed out by the infected person. And that is why you find for every of this infections that we're talking about, we can prevent them, right, by taking note of our environment, majorly taking note of our environment, taking precautions on how we respire or on how we relate with other people, and also by being mindful of our nutrition.
Regularly washing of hands.
Exactly.
Hand sanitizer.
That's one major thing each and every one of us must do, particularly when we're even talking about COVID-19. You see, so whichever of these three ailments we're talking about, they have a common or they have a similar modes of getting them transmitted. In fact, they can even be transmitted from blood to blood. So a mother who has this who has pneumonia or who had COVID-19 or even just influenza, is very likely that this mother can even pass on the same through blood to the unborn child. And maybe I should even mention some key facts about pneumonia today.
Okay,
so
let's go.
Pneumonia in itself, I must mention that it's one major killer of children. I mean, when we're talking about infectious diseases, or we're talking about infections that affect children under the ages of 2 or children under 5, let me just put it that way. Infections that affect them, there are many. But when we're talking about the ones that causes most deaths amidst children in the world today, in fact, WHO made us know that as of 2017, would you believe that 15% of all the child deaths of children under the ages of 2 that died from infectious diseases were from pneumonia?
15%.
15%. And again, there are several infections. There are several infectious diseases that affect children, but pneumonia in itself takes a huge chunk of the ones that would cause a child to die. So it's that important. And leaving children alone, adults ages of 65 or 60 and above, or people who probably have chronic ailments, or who have maybe the hypertension and they've been managing for a long time, or they have stroke, or maybe they have diabetes and they've managed for a long time, they are also susceptible to having
pneumonia.
In fact, not even just having pneumonia, but having a severe form of it, which can take their lives. So it's
their immune system is
exactly
has gone.
Their immune system is will not.
They can contact any.
And in fact, when they not even contact these viruses of bacteria and they get to have pneumonia, or they have a severe type of it. Their immune system cannot protect them as well. Same thing with COVID-2 as well.
Pneumonia. You talk about 15% of under the age of 2. I'm trying to balance something up. Pneumonia in Yoruba is Otutuaya. If I'm not wrong.
Yeah. You're correct.
At that age, I notice most parents open the body of their children. Maybe not covering with body. I think I see a lot of young, under that age, 3 downward. Sometimes just like possibly he won't wear, possibly wear, but maybe playing on the street. You see him alone, maybe on pint or one small shot. Could that have been an effect of why the high rate of pneumonia killing children?
Well, here it is. The reason why it's causes 15% of infectious disease deaths in children may not be because of that.
Okay.
Really, it may not be because of that. Reason why we're saying it causes the most amount of infectious deaths in children is that it's a disease that affects a major part of the body in children. And it's a disease that a lot of times, even before the mothers bring the children to the hospital, this disease has probably gone from mild to severe. So it's a deadly disease in a way. Anything that affects the respiratory system is already. If you can't breathe, if you can't, how do you survive?
Before you get to that severe level,
Stage.
the parents will not know, because they believe that this
it's just a small thing.
Whereas immune system wọn ò tí ṣe kíní tó báwọn ṣe rò, wọ́n lè lóoru mọ́mọ yẹn, ooru tó mú yẹn ó lè jẹ́ pátẹ́gùn tí kò sí láyà, àwọn tó ń ṣí àyẹ̀ sílẹ̀. But ṣé mọ̀ pé tó bá ti di pé ọmọ wà under age 5 yẹn, ní ó fi sọ pé ìtọ́jú wọn ó ṣe pàtàkì gan. Ìyẹn máa yẹ̀ wọ́n wò lẹ́ẹ̀mẹwàá. Tó bá ti di pé ó sín báyìí, tètè mọ̀ pé hospital ni ó já gbé lọ, torí pé kí ni àmọ́rú n tó fa tó fi ń sín, kò dẹ̀ lè sọ̀rọ̀, kò tí lè sọ pé báyìí ló ṣe ń ṣe mí, báyìí ló ṣe ń ṣe mí o, ní tí wọ́n fi jẹ́ pé ó rí bẹ́ẹ̀ yẹn. Ìsẹ́mi náà pẹ̀lú àwọn àgbàlagbà wa tí ọjọ́ orí wọn bá ti kọjá bí 65, wọ́n máa ń sábà nírú ìṣòro yẹn, torí pé kí ni gbogbo immune system wọn ó ti ṣe. Then àwọn náà wọn ò, pàápàá jùlọ àwọn míì wà tó yẹ pé wọn ò ní lè sọ pé báyìí gan ló ṣe ń ṣàwọn, tí wọ́n á ní àwọn àìsàn kan àbí mìíràn tí wọ́n ń bá jà kó tó di àsìkò náà, ó máa difficult fún wọn láti lè cope.
Then okay, back to influenza. You were talking about breathing in. Now, apart from somebody sneezing, somebody possibly contacting from another person, what are those things that it's possible to inhale that will actually cause influenza?
Thank you very much. So you're living in a crowded space. There's not good ventilation. Someone in that place has that infection or has influenza or has pneumonia, and that person sneezes or coughs, right? He or she has passed into the air the organisms that can cause you to have that infection. Or maybe you are in a place where there's so much air pollution. You put your generator maybe just beside your window, or you put your generator within the same apartment where you are staying, and this same generator is the one giving you plumes of, or giving you dose of smoke in good measure. Let me put it that way. And you are exposed yourself to this air. Within this air, you can have virus. Within that body of air pollution, you can have viruses. You can have the bacteria. You can have the fungi that will cause you to come down with influenza type of respiratory disease, or with pneumonia itself.
Now, people who work in factories, people who work with where there's so much smoke, how will they be able to prevent?
There are so many ways by which people can contact this disease that we are talking about. Let's take, for instance, there are some people, when they want to carry any object now, they will put their phone in their mouth.
Yes.
It's common. If you look at,
very common.
So that same phone, they can give it to you that, okay, you want to talk to Raymond. Oh, yeah, hold on. You will hold it with your hand. That hand, within 1 or 2 minutes, you have to touch your eyes, your nose, or mouth. So that is another means of contacting the disease. Another way is by using the system in the office. The keyboard. If you are infected and you are using it, another person will just come there. You can contact it. There are so many ways by which one can get this disease. So it's always good that we wash our hands regularly.
The one you've just said.
No, you will clean. Whenever you want to use the keyboard, you need to clean it.
Just get the wipe.
Just get the wipe and clean it. You know, in an advanced nation, they make provision for, toilets, even if you are traveling. Here in Nigeria, if you are going anywhere now, you just be looking at where you can do short puts. That is number one problem. If sanitation is very, very important. Very important. That's why they introduced another one for Thursday, Saturday and Thursday. That is not enough. Every day, cleaning is very important in whatever you are doing, in whatever place you are. So it's very, very important. If there is water, there are a lot that we can benefit from it. There is no water, so you have to go and fetch water and put it here. The way you are going to be using that water. Before I get this one, so you need to open the tap and be able to wash your hands very well.
And in fact, Ambassador, I think even if we have to be washing our hands every now and then, I think it's worth it. It's all. I mean, we're
Benny.
So to buy come off 5 minutes ni. Let's do it because it's just this one life.
Yes,
yeah, definitely.
There's no. I mean, maybe I don't know. Remember, is there a duplicate you probably have kept in your cupboard at home? Is there a copy you kept in the bank? I mean, maybe CBN would dispatch a copy to. No. So even if what we have to do, because these diseases we're talking about are in fact they are grievous and they are killing people, especially this COVID that's around. It's killing people greatly. And let me mention here one reason why COVID seems to be the king of them, of all these respiratory ailments we're talking about now. Right now, we're still just having vaccines around.
Yes.
For influenza or for pneumonia, one major way of preventing children from coming down with it, or preventing it from killing children, is that children now get vaccines. For pneumonia, children now get vaccines. For influenza. Right? But for COVID, still, I mean, we're just getting it rolled out in the developed nations of the world. In this part of the world, and we're still saying,
for instance, there was a time I traveled, like maybe let's look at it like between Ring Road and along the line, they have to tell us in the bus that, okay, if you need to freshen up, they will pack. At least we had about 3 stopover before getting there, because they know quite right that there are some people that we need to freshen up, because there is provision for it. When we get there, if you need to freshen up, so everybody will just get down and go to the restroom, wipe your face, wash your hands, go back to the bus. Then in the next few minutes, they will ask anybody that want to freshen up. Even if you don't want to freshen up before, there is provision for it. You just go there and do the needful. If such thing can be done here, it will be good.
It won't be bad to be in a work environment and then you get breaks to go and wash your hand.
Definitely.
It's not a bad thing, really, because when we look at it in the long run, we are preventing ourselves from coming down with a grievous ailment.
Yes.
And we're even doing a public service for others to helping others so they don't contract ailments from us. That is very, very important. So, be it for pneumonia, be it for influenza, be it for COVID-19, it's important that we take. For all of these diseases, we can go with the same precautions that we're applying to COVID-19 and use that to prevent us from coming down with these respiratory diseases.
Fitness Pensioners 106.7 FM. Influenza, pneumonia, COVID-19, 3 in 1, having similar symptoms. That has been the topic so far. 4:31, right here in the studios of Pensioners 106.7 FM. We'll take a break. And when we come back, we'll continue from where we stopped. Let's take a quick commercial break, and of course, we will be back.
Pensioners FM. This is Africa's model.
Kásùn kájí kájókòó rẹpẹtẹ kalẹ̀ ojoojúmọ́ dẹ́rẹ́bà ni wọ́n máa lò sá ìgbà wo ló ṣeré ìdá. gbogbo ẹ̀kọ́ lóògùn lílò ní gbogbo ìgbà àìbọ́kùnrin ọ̀pẹ́ rẹ lórí ìtẹ́ ọ̀pẹ́ rẹ ń gbára pètè exercise ní Keromli Gym and Fitness Center ló ń pàkíyèsí rẹ sí wípé lẹ́kalẹ́ka láàyè eré ìdárayá tí málàfíà bágun ara ẹni àwọn ọ̀dọ́ àtàgbàlagbà tó ń darapọ̀ níbẹ̀ wọ́n mọ̀ wípé àǹfààní àìlẹ́gbẹ́ ni wọ́n ń rí lágbo ara wọn o volleyball swimming table tennis bọ́ọ̀lù ẹlẹ́yin àfọwọ́gbá lórí pátákó gbogbo eré ìdárayá wọ̀nyí ó yàtọ̀ sí pé ó ń fún ọ lálàáfíà nìkan tó bá tún yàn án múṣẹ́ àṣẹ la tiẹ̀ ó tó rọ́wọ́ mú Keromli Gym and Fitness Center irinṣẹ́ eré ìdárayá ìgbàlódé kúnbẹ̀ dẹnu máa rẹ ilé mà lọ sáré látọjọ́ sí Mọ́kọ́lá ó léwu ní pópó o lè sá 440 lójú kan tó sì làágùn àrùn dànù bó fẹ́ sangun di ẹ̀rìmọ́ igẹ̀ àkótágìrì irinṣẹ́ ń bẹ bọ́dà bá pọ̀jù lára alára ò ní lè dágbé mẹ́rẹ̀ ìdárayá lọ́kùnkúndùn kàn sí Keromli Gyms and Fitness Center Ọbáfẹ́mi Awólọ́wọ̀ Stadium former Liberty Stadium Offering Road Ìbàdàn telephone 003-201-4009 003-201-4009 bó ṣeré ìdárayá Keromli lọ̀rọ̀ kan.
Pensioners FM. This is Africa's model.
Welcome back from the break. Still, Fitness and Pensioners 106.7 FM. And of course, we've been discussing influenza, pneumonia, and of course, COVID-19. I still got the team in the house. Keromli is here, and of course, Dr. Kinwumi is also here. I've been trying to find the Yoruba for influenza, and according to what I can see here, ayokele. I don't know if it's right.
Yoruba is one interesting language, honestly. Ayokele. What can you find the Yoruba for COVID-19?
I think ayokele there is ajakale for influenza. Well, for COVID-19, I don't know yet. Okay, let's go. Moving forward now. Influenza, is there any form of stage or types of influenza we have?
Thank you very much. So, Raymond, let me take this also for pneumonia and also for influenza. Now, we can classify, we can say, okay, this type of pneumonia that this person has is mild, depending on how the person presents with it. This type of influenza is mild, or it's moderate, or even severe in the person, depending on the presentation or what symptoms the person may be having as of the time he or she's being seen by his or her doctor. So we can put them into those categories or into those classifications, or we could at even different times look at the organisms causing them, okay, to use that to classify them. I mentioned that bacteria, viruses, fungi could cause pneumonia. Viruses causing influenza, you understand, or even bacteria causing that. Now, the type of organism that we find out is causing this disease can also be used to classify it as, or can also be used to categorize it. You understand? So, I mean, we can use any form of sorting to put them into classes.
Okay. Okay, in terms of sorting. Okay, but as soon as, let's assume something just happened and unknowingly I inhale possibly a virus from influenza or pneumonia, putting away coronavirus now. How do I begin to know with immediate effect, or let me say, when do I start knowing symptoms of it coming on me and I begin to detect, okay, do I have this or that, and the likes and the likes?
Let me take it from the question the Raymond asked just now. Ambassador, you notice he said leaving out COVID. He only picked on pneumonia.
No, influenza. There's a reason I left. I had to put out COVID.
Why?
See, I think when I started, I said influenza, pneumonia, COVID.
Yes.
They look the same.
Yes.
So
why did you now leave out COVID?
Where you finish?
They both have the same symptoms.
And when you finish on pneumonia and influenza, I don't want somebody to get. I mean, so they will now move to COVID.
Yeah.
Then match everything together.
Don't mind me. I was just we know what you are playing. He's saying that COVID all of He's saying COVID all of well, we understand, don't worry. For any of these infections, once the person contracts them, right? There's an incubation period when the organism would overcome the person's immune system, or when that organism would solidify its presence within the affected organ, within the organs, within the lungs. Now, you understand? So once this incubation period is done, a patient can start presenting with the symptoms. And let's hear, we must mention the symptoms of this disease. We must mention. So when a person is noticing coughing, a person is coughing and is producing phlegm, right? Could be of any color, producing phlegm along with that cough. A person is maybe noticing is sneezing. A person is running temperature. Okay, these are things a person would come with when he or she is having maybe pneumonia, or even COVID
Shortness
itself.
of breath.
Short, exactly. And all
tiredness and weakness.
Thank you very much, ma. A lot of them.
Sore throats can even come along.
Some people say, I've been having this itchiness in my throat. I'm having this pain in my throat. That's part of it too. That's part of it too. And for all of these three, these symptoms that we've mentioned are common to them. They are common to them. But also, for clarity's sake, we must also mention the particular ones that are now even common with COVID. I mean, going by how important COVID is now. I mean, today, when a person is having difficulty breathing or pain in the chest, or a person is having loss of smell, is not able to perceive a common odor. I mean, so they spray perf around near you now, and they say, hey Joe, perf is hey, go pay for me. When the person gives you that, face mask in that exactly, because this is common to COVID. Or a person knows that is a person is having fever, or just feeling tired, headaches.
You know, we said it the other time that any ailment at all will come with headache. So you can't just say, okay, this one is malaria. Just make sure you go to your doctor and let the doctor
examine and test
you
exactly,
and establish the fact that it's not COVID, it's not influenza, is this.
Okay. Almost the three having the same symptoms. Let me open the phone lines officially for people at home. Please don't be afraid, because I know when anybody talks COVID now, anyway, 09081111067, 09081111067, or 080101067, 080101067. You can ask questions. Don't forget, you can also watch us live on Facebook, Pensioners FM. You can also drop your questions there. We take everything. We got the experts in the building. And like I used to say, do not hide whatever is wrong with you. Money or what man doing, or can you see a biasha? She will be over there. She will try.
I
mean, okay, now pneumonia, COVID-19, influenza. We've discussed what could be the cause. There are symptoms as well. I mean, coming, but then early symptoms could last for how long before it jumps to something bigger?
Well, I think I will put that down to each person, each individual individual category. So for children to be different. For a person, for an adult who is probably under 60, be different too. Or for someone who has above 60, above 65, and that range, be different too. Because of course, this has to do also with our immunity. It has to also do with whether you've taken vaccines or not. I mean, I mentioned that for influenza, for pneumonia, there are vaccines that children do get these days. But for COVID, there are no vaccines. There are no vaccines. And in fact, for even COVID, a person could even have it and not even show any symptoms. Exactly, not show symptoms at all. So it depends on the individual. Depends on
the immune
system within that same person as well. So this one I presented early, or that I presented late, may not it's not as important as if you are strong enough to handle the ailment itself, or if you are strong enough to survive the disease. And that is what's very, very important for us all to take note of.
Let me buttress what you have just said. You know, in children, anytime they are vomiting, having temperature, diarrhea, we say, ọmọ yẹn ń ṣe tẹyin ni.
Yes.
That's why doctor do tell us at in the hospital that it's not, ẹ má sọ pé eyín lọmọ ń ṣe o. Tí ẹ bá ti kó fìdí pé ọmọ ń gbóná, ó ń vomit, ó dẹ̀ ń run stool, ẹ máa gbé bọ̀ nílé ìwòsàn. Àwọn ti gbà eyín ni ẹ bá ti ń ṣe tẹyin ẹ wò iwájú orí rẹ̀ ó mọ̀ gbóná báyìí, kì í ṣe eyín ní í ṣe o. Ó lè jẹ́ influenza, ó dẹ̀ lè jẹ́ pneumonia. Ló fi jẹ́ pé tí ọmọ bá ti ń nírú nǹkan báyìí, torí immune system wọn ò tí strong débi pé kí ẹ̀ka sọ pé orí fífọ́ yẹn já fún ní oògùn amára ṣe kíní lọ ilẹ̀ yìí rárá o. Títí wọn yẹn yàtọ̀, bẹ́ẹ̀ náà ni àwọn àgbàlagbà. Àwọn méjèèjì yẹn categories àwọn méjèèjì yẹn yàtọ̀ tó yẹ pé èèyàn gbọ́dọ̀ fọwọ́ yẹpẹrẹ mú tí èèyàn bá ti di pé èèyàn kẹ́fìn pé irú nǹkan báyẹn ń ṣe wọ́n, torí pé kí ni àwọn àgbàlagbà yẹn náà wọ́n ti dàgbà tó yẹ pé immune system wọn náà kò fi bẹ́ẹ̀ ṣe,
àwọn náà ti ń dàbí ọmọdé
kéré padà.
Okay. 090-81-11-1067 or 080-8010-1067. Once again, the phone lines 090-81-11-1067 or 080-8010-1067. Moving further, Doctor, I was in on the chat now. I saw, I think the person is not based in Nigeria now. I saw COVID-19 test. She did November, I think twice. She did December once. The next one she did, it was positive. Okay. Now I was now beginning to wonder. Or the person be like, kí ló ń wá kiri? Kí ló ń ṣe test kiri? Wọ́n tó test tó ṣe ló jẹ́ kò ní. So as you were speaking now, it just came to my brain. In this part of the world, we are afraid of going out for tests. No matter what. Well, tí n bá ṣe, ǹdẹ́ yóò bá mọ̀ kí n pààyàn.
But I don't know, will not kill me.
Ǹdẹ́ bá mọ̀ lè pààyàn jàre mi ṣe test kankan.
I mean, God.
Ṣé orí pẹ̀lú nǹkan tó sọ nísìnyí, ara tí ó fi ṣe pàtàkì ká máa bomú wa, ká máa ṣe gbogbo nǹkan tí ìjọba ní ká máa ṣe. Torí pé kí ni kì í ṣe fún àǹfààní ara nìkan, fún àǹfààní àwọn yòókù náà. Ó ní ẹni tí ṣe ní November, ó ṣe ní December, ó tún wá tún ṣe ní ìsìn, wọn ló ní kò ní àwọn àkọ́kọ́ àti ẹ̀kejì tó ṣe. Ara tí à ń sọ ni bóyá nígbà tí ò ti níyẹn, ó bẹ̀rẹ̀ sí ní lọ káàkiri tí ò ṣe gbogbo àwọn measures tó ní ká máa take mọ̀ pé kí ni òun òkú ni tó ń ṣe lẹ́ẹ̀mejì, ó wá padà ṣe lẹ́ẹ̀kẹta ó ti ní. Ó ṣeé ṣe kó jẹ́ pé àwọn tí ó ní ló fara kẹ́ látara wọn ló ti kó. Ló fi jẹ́ pé a gbọ́dọ̀ ṣe gbogbo nǹkan ní ìmọ́tótó, pàápàá jùlọ ọwọ́ wa yìí ká máa fọ̀ ní gbogbo ìgbà, torí pé kí ni láàrin wákàtí kan ó pẹ́ jù á ti fọwọ́ kan mú, fọwọ́ kan ojú, fọwọ́ kan gbẹ. Torí ẹ̀ ni wọ́n ti mọ̀ pé tó bá ti dé bi àwọn ojú yìí, ṣe bí nǹkan náà sọ ní ìsìn náà, we are talking about influenza and the pneumonia, COVID-19. Méjèèjì ṣẹ́rí tó má ti ṣẹlẹ̀ báyìí, ojú, imú, gbogbo ẹnu, gbogbo ẹ̀ ló máa tó fi mọ́ throat ló lè gbà wọlé. Tí ó bá dẹ̀ jẹ́ tí pneumonia yẹn ni lungs yẹn ó máa wú ni. Nígbà tí ó bá tí àyè ò gba atẹ́gùn gan láàyè láti wọbẹ̀, ṣe mọ̀ pé ìṣòro ti dé nìyẹn. Ló fi jẹ́ pé gbogbo àwọn nǹkan tán ní ká máa ṣe, ẹ jẹ́ ká máa ṣe fún àǹfààní ara wa àti fún àwọn tí a jọ wà láwùjọ.
Another reason why people get maybe skeptical or afraid of doing tests, let's mention that too, is that stigmatization.
Okay.
Ìtí máa lọ ṣe test yìí.
Tó máa lọ mọ̀.
Raymond ò máa ní kí mi mọ̀.
Raymond ò mọ̀ ju ọ́ sí mi lọ́ọ̀kan.
Ìjọ́ tí mo ní malaria lásán, Raymond ò máa tiẹ̀ kí mi fọ́sẹ̀ kan.
Ká tó wá sọ pé
gbàdádù ló máa mọ̀, ẹ máa kí mi ya Bísí ẹ pẹ̀lẹ́ COVID o, ya Ṣẹ́gun ẹ pẹ̀lẹ́ COVID o, ṣé ti jẹun.
Ìsúnmọ́ ọ̀kan owó ti mọ̀ sí.
Ṣé COVID náà ló jẹ́ ẹrù báyìí?
Bóyá ti rù tẹ́lẹ̀.
Wọ́n rí tẹ́lẹ̀ o. COVID tẹ bá rí ya Bísí, ó ti wá COVID ti mú.
Ṣé COVID ti mú?
COVID ti mú. Ìgbà tó wá rí tó ń bọ̀ láti hospital tó ní COVID ló ṣe òun, COVID ni.
Ó ti ẹ̀ lè mọ̀ sọ pé COVID ó kàn lè lóun lọ sọ hospital fún àyẹ̀wò ni, wọ́n bá yí sí COVID. Ohun tó ń fà á tí àwọn àwùjọ wa tí wọ́n fi dé pé bí nǹkan mélòó gan kò ní fẹ́ bọ́ta láti lọ sọ, ó sì léwu púpọ̀. Tí nǹkan bá ń ṣe wá, ẹ jẹ́ ká tọ̀ dókítà lọ, ní oògùn rẹ̀ fúnra wa.
Wọ́n ní ambassador ẹ rí pé àwọn bọ́ọ̀sì CDC wọ́n wá sí ilé kẹta sọ́dọ̀ yín bẹ̀yìn. Ó máa ti ní COVID, mi wá sádùúgbò yín mọ́ o. Mi ò tiẹ̀ wá sádùúgbò. Ṣé kí n tẹ fẹ́ send ẹ bá mi fi ránṣẹ́? Ẹ má tiẹ̀ fi ránṣẹ́. This is the stigmatization we're talking about. You understand? This is why people get afraid to want to do tests that are very, very important for their health. And we are here to tell them that please do not stigmatize against anyone that has been confirmed or that was suspected to have any ailment at all, be it COVID, be it pneumonia, be any disease at all. Do your best to socially support this person while also taking note of the precautions for your own health. That is the responsible thing to do, not to stigmatize. If we stigmatize less, then we'll have more persons coming forward to do tests and safeguard their health.
Do not stigmatize. You hearing that from Dr. Kinwumi, saying no matter what, even if you know of anyone who has a particular disease, not just COVID, do not stigmatize. Don't use that disease to call the name. Don't fall in love. Àbàdí tó ní kinní yẹn ni ṣó ti gbàgbé orúkọ ẹ̀. Àbàdí tó ní àìsàn yẹn.
Lọ́dún yẹn náà òun nìkan ló ní COVID.
Òun nìkan wọ́n máa fi sorúkọ ẹ̀ ní immediately.
In fact, Raymond just kí ẹ fi ṣe orúkọ bọ́dá yẹn ṣẹ́gun COVID. Ẹ má jù mọ́ àní ṣé òun ló ní COVID lọ́dún yẹn tó mi that's part of the stigmatization we're talking about. That stigmatization is there. Bọ́dá yẹn ní COVID ẹ jẹ́ kó wọ mọ́tò yín ẹ sọ wípé mọ́tò ti kún.
Àbọ̀ wọ mọ́tò báyìí gbọ́n kàn rọ̀dá lẹ́yìn. Kí ló dé mo lẹ́lẹ́
ẹ má pè náà
lọ́mọ ní àlọ́sọ̀nà bẹ̀rẹ̀ mọ́ ni.
Ẹ wo
ó bá rí rẹ̀ nu mọ́tò ó wà ṣẹ́jú sóní mọ́tò.
Mọ́kọ́lá tẹ́lẹ̀ fẹ́ lọ yẹn a lè gba I think ó dàgbà lè gba challenge wọ Mọ́kọ́lá challenge ta fẹ́ lọ gbà. Bọ́tẹ́ ti dé sábò yẹn ẹ mọ̀ pé sábò ta fẹ́ gbà yẹn mikra máa ń pọ̀ lọ́nà yẹn ẹ já lọ gba challenge wọ so ẹ má bínú challenge la ṣe fẹ́ lọ́nà kátó wà máa bọ̀ Mọ́kọ́lá. That's part of stigmatization we're talking about.
It is where when COVID was trying to go away, I was with my friend, and you know what he had for in his own area. He just says, "Raymond, akukoro."
Àbí corona.
Only corona. Only Yorùbá kò sí rúkì tán lè kí.
Kò sí greetings dé ò sí ní Yorùbá.
Akukoro.
Everything is
Aku.
Okay, going to forward now. Having a good balanced diet, like we always say,
yes, nutrition.
It's always a factor to having a good healthy life.
Very true.
Now, pneumonia, influenza, COVID-19. What sort of food and fruit should we be eating?
I will
preventing and of course
and managing. I will jump at this and say good nutrition. Yes, good nutrition. Balanced diet, healthy leafy vegetables, green vegetables, taking clean water, right? Ensuring that you are taking, thank you very much. You are taking fruits. You're taking as much fruits as you should. These are the ways you can ensure your body is able to fight off every ailment, fight off every infection that might come in. These are the things you must do. These are the ways you can prevent you from coming down with severe forms of this ailment. Don't forget, our immunity plays a very, very, very important role in any disease at all. It plays a very, very great role. Our immune system is like the soldiers that are already in our body. Just waiting, and they're sitting there. They are on alert. They're not just sitting in the barracks. They are on alert, patrolling. Where is that pneumonia coming from? Where is that COVID-19 coming from? Where is that influenza coming? Exactly. So whenever this, even if you she gone give COVID contact on body wale, and your immune system is strong enough, right? Then you have a better chance of surviving that. Your immune system is good enough because you are taking good food, nutrition, and you are also, getting supplemented with good vitamins from fruits, from diets, from water. I'm not saying alcohol. I said water. Don't forget. Right. Exactly. And also taking note of some other social habits, smoking. Right. If you can starve off this and you can starve off alcohol too, you put your body, your immune system in the best shape to clamp down or to tackle any disease at all or any infections at all, both for you being an adult and also for children.
Both for you being an adult and also for children. If you have a good immune system, then you have a chance of fighting against any of these diseases. Now going forward, exercise now. Is there any form of exercise that can prevent and also to manage in case of the disease is already in? Especially
for our elder statesmen. There are a lot of things they can do. Aerobics is one of the exercise that is good for them. But with this
aerobic, Emma break it down. We can audience aerobic every Monday. Me team on aerobic. I just bound for see where
àwọn ìyá wa ṣe mọ̀ pé bí COVID ṣe wà yìí most of them inú ilé náà wà, gbogbo social gathering yẹn wọn ò lọ bẹ̀ mọ́, pàápàá jùlọ àwọn tó jágbàlagbà torí kan sọ pé àwọn tí ọjọ́ orí wọn bá ti wà ní bíi 60 kankan yẹn they are at risk of having COVID-19. So torí ìdí èyí wọ́n jókòó sójú kan náà ni ṣe bá ṣe jókòó sójú kan náà yẹn oríṣiríṣi nǹkan ni ó máa tún ṣẹlẹ̀, pàápàá jùlọ àwọn tó bá ti ní àrùn kan àbí òmíràn tí wọ́n ń tọ́jú tẹ́lẹ̀ bóyá bíi diabetes, bóyá bíi hypertension, stroke, cancer nǹkan kan báyẹn ṣe mọ̀ àwọn ìyẹn ni ó jẹ́ pé wọn ò gbọ́dọ̀ ní any slight issue pẹ̀lú gbogbo ohun tá à ń sọ yìí pé wọ́n fi mú kó nǹkan àbá o lè wá trigger gbogbo nǹkan tó ti wà ní ara wọn.
irú ìtàn tó máa wá ní a tún wá burú ju
aburú ju àwọn àgbà ó ṣe wá wọ́ọ̀sì báyìí torí pé kí ni kò sí èjì ò sí ní side wọn tó pé wọ́n ti dàgbà bó ṣe ń jókòó sínú ilé yẹn most of them tó pé bone density wọn ó ti weak. ẹwà tìgbà tí COVID ti wà yẹn the only thing tán lè ṣe ni pé n ò lè máa lọ ṣiṣẹ́ agbára kan àbí mo fẹ́ gbé nǹkan fẹ́ ṣe kinní kan, ẹni tó bá ní garden lẹ́yìn ìkùlé kó bọ́ síbẹ̀ kó ra máa ṣe bó ṣe pé àwọn grandchildren ló máa pé Kọ́lá gbé shovel yẹn wá, Bùnmi bu omi sí pan yẹn, ó yá wet flower yìí ṣe rí ọwọ́ nǹkan tí ó ń ṣe yẹn tó bá ń ṣe ó kéré jù bóyá bí ẹ̀mẹ́ta àbẹ́ẹ̀mẹ́rin lọ́sẹ̀ is good torí fún èjì wọn. ẹlòmíì dẹ̀rẹ̀ bóyá láàrin inú ọgbà wọn bẹ̀ náà wọ́n lè rìn lọ rìn bọ̀ within the perimeter of the house kan lọ bẹ́yẹn kan lọ káàkiri kan rìn, ó wá kéré jù èèyàn gbọ́dọ̀ máa rin ìrìn 20 ìṣẹ́jú sí 30 ní ojoojúmọ́ tí èèyàn bá lè máa ṣe yẹn ìyẹn tún dára jọjọ. tí wọn ò bá lè ṣe yẹn ṣe pé àwọn exercise tí à ń pè ní aerobics tá à ń sọ oríṣiríṣi ni inú ẹ̀ náà ni pé kéèyàn gun bicycle, ṣùgbọ́n àwọn ìyá arúgbó mi tí ì bá ṣe pé àwọn tó bá jẹ́ pé ìlú òyìnbó ni wọ́n dàgbà sí pé àtìlẹ̀ náà ti máa ń ṣerú ẹ̀ irú ìwọ ìgan bá ní ogun ọ̀kadà àbí bicycle gan lè mọ́ lè dàgbù.
ìyẹn dìgbà náà.
láti wá sọ yìí pé tí wọ́n bá lè ṣe pé wọ́n tẹ́ ẹní sílẹ̀ tán jókòó tí wọ́n rán ẹsẹ̀ tí wọ́n napá tí wọ́n ṣe àwọn mìíràn máa ń ṣe lórí àga, ó gbọ́dọ̀ jẹ́ àga tí ó ṣe dáadáa tí wọ́n á jókòó sí ṣe pàṣẹ àga tí ó kàn mọ́ wọn lẹ́sẹ̀ tó bá ń ṣe, so wọ́n á sọ bó bọ́n ṣe máa ṣe àwọn programs yẹn fún wọn. àwọn míì máa ń swim ní lílùwẹ̀ ṣùgbọ́n àmọ́ ojú ẹlòmíì wà tí ò mọ̀ pa à ń lùwẹ̀ kó má di pé èèyàn tún wá dá ọwọ́ sílẹ̀ ló fi jẹ́ pé àwọn nǹkan kéékèèké yìí ni wọ́n gbọ́dọ̀ máa ṣe fún wọn tí wọ́n á bọ́ síta tí wọ́n ra gbatẹ́gùn níwọ̀n tí wọ́n á dẹ̀ ṣe tí ò ní jẹ́ pé wọ́n ń jókòó wọ́n accumulate fat jọ sójú ojú kan náà. ṣàpè a sọ nípa obesity the other time pé àwọn tó bá ti jókòó kalẹ̀ sójú kan náà wọ́n máa ń ní ìpèníjà àrùn oríṣiríṣi nígbà pé wọ́n jókòó wọ́n jẹ ilé wọ́n jẹ tọ̀ wọ́n jẹ gbẹ̀ ojú kan náà ni wọn ò ní dìde. so kí wọ́n bá ní irú ìpèníjà yìí àti kí wọ́n bá fara kó àṣà COVID-19 wọ́n nílò rírìn káàkiri ó kéré jù 20 ìṣẹ́jú sí 30 ìṣẹ́jú ní ojoojúmọ́.
Exercising your body is one way of preventing any form of diseases. And of course, of our elder statesman, just like Lee have said, taking a walk 20 to 30 minutes every day, and of course, not sitting down for too much. Take a walk, exercise your body, walk around, and of course, you will be doing your body a very good favor in a bid to prevent not just pneumonia, not just influenza, not just COVID-19, but also any form of disease. I think that's for either statement. Àwọn táwa jọ dọ̀bà ẹ̀ tẹ́ pé egungun wa lè pé a lè sáré láti fi dé Dubai.
Ẹ̀yin tẹ́ bá ti wà hyperactive in nature báyìí náà kẹ́ ẹ bọ́ tàkẹ́ lọ́mọ sáré kiri ni. Ẹ mọ gbára lẹ̀ dé marathon. Nígbà tí egun wà ń bẹ ṣùgbọ́n gbogbo tá a sọ síwájú náà ní kẹ́kọ́ ẹ fi ìdí ẹ̀ múlẹ̀ pé ó yẹ ìfúnpá rẹ wò ó dúró déédéé torí pé òun kọ́ síwájú orí bó ṣe jọmọ kékeré ó lè ní ìfúnpá tó ga. Ìṣe pé orí ọlọ́run má jẹ́ kíní tí mò ń sìn ò ní jẹ́ torí pé kí ni tó bá jẹ́ ojogún ẹ̀ láti ara àwọn parent àbí àwọn forefather ti ní tó wà lára àwọn ìyá àti bàbá tí yóò hàn síta bóyá lára titi ẹ̀ ló ti fẹ́ hàn ká máa sọ pé ọ̀dọ́ ni mí mo léegun ajẹ́nbọ́ta kí n lọ́mọ gbé irin kò ṣeé ṣe bẹ́ẹ̀ o a gbọ́dọ̀ fi ìdí gbogbo àwọn àyẹ̀wò yẹn múlẹ̀ pé mo dúró déédéé ó yá good to go.
Oh, yeah, good to go. 4:57 by our time, and of course, seems like we are reaching the home stretch already. But before we go, a bit of advice to elder statesmen, and of course, in case of anyone having any of these diseases.
See your doctor, right? Call on your doctor. When we pay attention to our health and we notice things that are not going right, and then we call on our doctors in time, they can we have a head start on recovery, because it's our doctors that will now say, okay, this is what we should do. Okay, these are the tests that needs to be done, and this is how we can manage this ailments better. That is what is necessary. Okay. Not by saying let me stay at home and let me take this one. It's not by doing, it's by speaking out, it's by consulting with people who can help us, and thereby we may be able to we may just get the right attention that we need, or the right treatment that we need for that particular ailment.
You know, we said it on this program sometimes ago when we were talking about elderly statesmen, that they should try as much as possible, I mean the family member, to be, having social support with them, because they needed them most now. Because if I think is when we are discussing about dementia that we mentioned this thing, that if you go to mama regularly and say, mama, kini tí mo fún yín lọ́jọ́ yẹn kan bo lẹ fi sí, fún mi ní nǹkan kan, easily you know that this woman is suffering from dementia. Because it's the family member and the friends that they will easily notice that. But if you cannot pick it up, how will you be able to tell the doctor? So the earlier you detect this, the better, so that before it gets out of hand. So it's always good that we come to them, we ask questions, and we are able to provide solutions to their problems.
Okay. It's very good we come to them, of course, get by them and ask questions so that we can get solution to their problem. I have to say a very big thank you to Keromli and of course Dr. Akinwumi for coming on board today. Again, another exciting moment on fitness.
Raymond, is always a pleasure. I enjoy always being here. I enjoy being here.
Thank you for having me. By next time, we are going to be in 2021.
Definitely. Of course, that's the sound of a package today on Fitness on Pensioners 106.7 FM. Thank you, everybody that have listened to us. Join us on Facebook as well. Of course, thanks to our producer, Baba Tunde Tiami. Next time you hear from us, it is definitely going to be January 4, 2021. And of course, we'll say Happy New Year in advance. Good evening.
There is that radio station that cares about the people. Looks out for the missing here among us. Shines the light into darkened souls. It's not just the professionalism